somebody who's over the age of 65, they fall, and because they have poor bone density, they then break their hips. 10 to 20% of those people die within the first 30 days. And it's not just about living, it's about maintaining the quality of life. Of those who have a hip fracture, 50% of people lose the ability to walk independently. And I would tell you just from experience, this causes a lot of concern for people. You really see the impact it has on them psychologically. Welcome to the Foundation's first podcast, Health, Strength, and Success. We're building tomorrow, starting today, based on scientific evidence. I'm Dr. Patrick Denard, and today's podcast is about why you should care about bone health early in your life, not waiting until you're 60 or 65, but in your 20s, 30s, 40s, thinking about your bone health and why this is a big impact on how your quality of life will be later in life. Today's podcast is sponsored by Complete Surgical Nutrition. The average American will have 6 surgeries in their lifetime. Evidence shows that nutrition is an important part of recovery. Supplementation can improve speed of recovery and lower the risk of complications. CSN was formulated by surgeons to help optimize your recovery after surgery. If you or a loved one are having surgery, more information is available at www.completesurgicalnutrition.com. So I want to start off with some facts about bone density, just to sort of set the stage here. Bone density peaks in your 20s, okay? And it declines in your 30s. So we reach our maximal bone density early in life. For women, it's a little bit of an earlier age than men. For men, it's about their mid to late 20s. And for women, it's in their early 20s. And then somewhere in our 30s, it starts to decline. And this is related to several things. One is just age. The other is hormones. We have hormonal drops in both men and women. Women experience a bigger drop in bone density, probably related to the decline in estrogen. Also, another factor is a decrease in exercise. And we're going to talk about why exercise is so important in maintaining bone density. Genetics is a factor. Of course, that's out of our control. We can't control who we were born from. So we're going to really not dive into genetics so much and really talk about what are the modifiable things we can be doing. But it's important to understand that as bone is alive. And in orthopedics, we talk about bone remodeling in response to stress. And that's something that we learn at a very early time in our training. And based on that, we try to encourage people to do exercise to maintain their bone quality. And we also think about this in terms of things that we do with fixation, that is fixing fractures or using implants, etc. So women, they do not reach the same levels of bone density as men. And again, they get this steeper decline in estrogen. For instance, they get a 20% decline in the first 5 to 7 years as menopause, after menopause. And so what that means is that if you're going to reach this maximum early in life, the better you can be prepared to address that decline, that is, the higher level you can be at earlier on, that's probably for the best. And according to the CDC, 4% of men and 19% of women over the age of 65 have osteoporosis. Osteoporosis is a definition that's based on bone density taken from typically a DEXA scan, which looks at your bone density in your hip and your spine. And that's quite a large number. So 4% in one case in men and 20% essentially in women, or 1 in 5 women, has large ramifications. So why should you care about this early? Well, it's trying to think about the future. And one of the things that I see very commonly in my orthopedic clinic is people later in life with poor quality bone. A common scenario is somebody will come in, as I see as a shoulder specialist, somebody who's broken their shoulder, and they will be very, very concerned about their bone quality. And this will affect the ability for me to fix a fracture or a broken bone, or simply do something like fix a rotator cuff, because you can imagine if I'm trying to put anchors into a bone to fix or repair a rotator cuff, that relies on having good bone quality. And I would tell you just from experience, this causes a lot of concern for people when they're worried about their bone quality. You really see the impact it has on them psychologically. Now, to take that a step further, if you look at hip fracture, this is when somebody breaks their hip. This is one of the most devastating complications that can occur from poor bone quality. And the statistics on this are alarming. So the typical scenario is that somebody who's over the age of 65 has a slip and fall because they have probably decreased muscle strength, a little bit of imbalance problem, or just an accident. They fall, and because they have poor bone density, they then break their hip. Well, if you look at the numbers on that, again, it's alarming. It's 10 to 20% of those people die within the first 30 days. If you look at 1 year, it's 30% mortality or death within 1 year. So we're talking about something that has a substantial impact on their life. The number is 50% at 5 years. And it's not just about living, it's about maintaining the quality of life. So of those who have a hip fracture, only 50% get back. So 50% of people lose the ability to walk independently. Definitely something you want to avoid. So why is this? Well, partially it's a reflection of their overall vitality, but partially it's because if you have this type of injury, you end up getting irreversible muscle loss that leads to difficulty in recovery. So how can we treat or prevent this problem? And I think the best emphasis really is preventing osteoporosis or decline in bone density in early age. And I want to cover 3 main topics. Okay, the first is exercise. The second is vitamin D. And the third is alcohol. I'll mention smoking as well, but alcohol being the major one because I think it's a very common aspect that people can control in their life and think about. So let's look at some of the data on exercise and bone mineral density, that is your bone quality. So this study is a comparison of bone-targeted exercise with and without anti-resorbative bone medication to reduce indices of fracture risk in postmenopausal women with low bone mass, a randomized controlled trial. This was published recently. So what does this mean? So anti-resorbative therapy, that's a medication that you can take to prevent the breakdown of bone. So as I mentioned before, bone is a living organism, and there's a balance between bone formation and bone breakdown. Now, there's medications that can target actually increasing bone growth, but most of the medications, like a Fosamax, people have probably heard of, is targeted to decreasing bone breakdown. So in this study, they took 155 patients and randomized them into 4 groups. Randomization means that you drop people randomly, as it says, into different assigned treatment groups. This prevents bias in the study, really controls the scientific robustness of the study. So the groups were high-intensity interval training, Pilates, high-intensity interval training with medication, those anti-resorbative medications, and Pilates with medications. They had an 8-month follow-up period. The Pilates group, I think, is pretty self-explanatory. Many of us know what Pilates is. In the high-intensity interval training group, they did back squats, deadlifts, overhead press, and a jump drop. And as that is described, essentially people were holding from a bar and coming down. There's different descriptions of a jump drop, but that's what they did in this study. Now, if people did high-intensity interval training, they had a 1.7% improvement in bone density over that 8-month period over Pilates. If they did high-intensity interval training with medication versus Pilates with medication, it was 4.5% increase versus 0.5%. Now, this may not sound like a big increase in bone density, but I think it's important to recognize this is just over 8 months. And actually having an improvement in bone density of that is actually a substantial amount. So it appears from this study that doing actually weight training adds a benefit in addition to medications, and it's more important than something, or more beneficial than something like Pilates types of exercise. Now, what's interesting as well about these types of exercise is that the study I just mentioned looked at postmenopausal women. So these are women who are of an older age group. But actually, there's information such as a meta-analysis from the Journal of Sports Medicine that looked at 17 studies and found that in girls, even at a younger age, there's small but significant differences in adding resistance training and bone density. This sort of gets back to what I was talking about earlier, that if you can build your bone density at an earlier age, you're going to be in a better position because we're going to have this decline that's inevitable. So we want to be as in a good of position as we can going into that decline. And we want to try to lower the steepness of the curve or decline by adding resistance training. Okay, let's talk about vitamin D. So vitamin D is commonly recommended for people, and we know that in the United States, about 1/3 of individuals are vitamin D deficient. And that has to do with the latitude at which we live, because the further we are away from the sun, the less vitamin D we get, because one of the ways we get vitamin D, in addition to our diet, is by getting sun exposure, because our bodies convert sunlight into vitamin D. Now, I think it's really beneficial to take vitamin D, but I think it's important to look at the evidence. So a study on calcium and vitamin D for increasing bone mineral density in premenopausal women was published in 2023. This was published in the Cochrane database. Now, the Cochrane database tries to take studies, combine those, and they are very, very stringent in their conclusions. So they did a meta-analysis of 7 randomized controlled trials, 941 patients, mean age of 18 to 42, so means average. So younger individuals, 138 were randomized to calcium supplementation, 110 to vitamin D supplementation, and 271 to vitamin D plus calcium, and another 422 to placebo. Now, in this study, actually, there was no difference in bone mineral density by taking calcium or vitamin D. So does this mean you shouldn't take vitamin D? I would not say that, because vitamin D definitely has a role in bone mineral density, and there's additional benefits. Some evidence, for instance, suggests that there's a relationship between vitamin D and HDL levels. HDL is your good cholesterol, as is commonly called, and it's been shown that it actually may increase your HDL levels. In addition, it probably is something that could be multifactorial. For instance, there's increasing evidence that magnesium in relation with this can also increase bone mineral density. So the NIH recommendation, or the National Institutes of Health recommendation, is 800 international units over the age of 75. And that's based on evidence that it reduces the risk of broken bones. However, when you look at the number of people who are vitamin D deficient in the United States, I would tell you it doesn't seem that there's a downside to starting vitamin D at an earlier age based on this idea of trying to prevent that decline. Additionally, as an orthopedic surgeon, one of the things I commonly see is that people with vitamin D deficiency have other problems. So I'm a shoulder specialist, and it's well known that vitamin D deficiency is associated with rotator cuff tearing. Moreover, it's not just associated with tearing. People who are vitamin D deficient have a lower healing rate. Now you might say, well, rotator cuff, that's a shoulder problem. That's not common, but it turns out that 50% of people at age 65 will have a rotator cuff tear. So despite the evidence that says that it may not be necessary, there doesn't appear to be a downside, and I would encourage people at an early age to take vitamin D. So aside from exercise and vitamin D, how do your habits affect your bone density? Well, it's well known that either smoking or alcohol intake decrease your bone density by about 15 to 25%. Smoking is becoming much, much less common in our society, but alcohol is obviously very common. It's consistently around us. If anybody has even tried to do the dry January, they just get a better sense of how common and how much we are inundated with alcohol. So I thought it'd be interesting to look at some of the studies in relationship to alcohol and bone mineral density. So when we look at the evidence, and again, I'll provide these studies in the show notes, it appears that mild drinking, for instance, 1 to 2 drinks per day, probably has no detriment on bone density. Now, you have to keep in mind that there's probably a difference between men and women because there's a smaller amount of alcohol that's going to affect bone density in women than in men, primarily just based on body size, but perhaps also based on hormonal levels. Heavy drinking, on the other hand, that is above 2 drinks per day has an impact on your bone density. So an interesting thing to think about actually is at a young age, and what impact does binge drinking have on your bone density? We all know that every fall, new graduates from high school go off to college and they're going to engage in massive amounts of binge drinking. So does this have long-term consequences? Well, it actually looks like it might. So a study in rats looked at bone loss. They simulated 5 drinks for men and 4 for females. So that would be a heavy amount, and looked at bone loss after 3 weeks of 3 days of drinking. So this would be a college equivalent. That group of young individuals is going out Thursday, Friday, Saturday night, drinking 4 to 5 drinks or more and seeing what happens with bone density. Interestingly, not only did bone density levels decline with binge drinking, the values did not return after abstinence. They actually remained 15% lower. So it appears, or it's possible, that binge drinking has long-term consequences that affect your bone density. Now, I'm not going to tell everybody they cannot go and do that, but certainly if you're going to do that, you certainly want to be thinking about offsetting that with strength training exercise and even perhaps vitamin D. So let's summarize the information that we've gone over here. First of all, decline in bone density is inevitable. There are certain factors that are out of your control, such as age, hormonal decline, I'll say, kind of, because there is the obvious option of hormonal supplementation. But generally speaking, you're going to have a decline that you cannot control. So the best thing you can do is be in a good position going in. You have modifiable factors that affect your bone density that include exercise, smoking, and alcohol intake. Vitamin D evidence is limited, but there does not appear to be a downside, and there may be other benefits of taking vitamin D at an early age. And lastly, binge drinking actually may have permanent consequences. So try to avoid that. And if you can't, offset it with those other habits. So thank you for joining us on the Foundations First podcast. I hope you enjoyed the information. All of the studies that I talked about will be available in the show notes. If you like this podcast, please like us, please subscribe. And if you're so compelled, please give us a 5-star review. On the next podcast, we're going to talk about the evidence behind career success, how happiness is related to career, and look at the science behind that.